Let's talk about the treatment options for prostate cancer. One treatment option is active surveillance. Active surveillance does not actually treat prostate cancer. It monitors the cancer growth with regular PSA tests and periodic biopsies. A schedule for tests will be set with your urologist. To help your urologist do these biopsies, a multiparametric magnetic resonance imaging or multiparametric MRI exam might be done. With active surveillance, your doctor will know very quickly if the cancer grows. If that happens, then he or she will suggest next steps for you. At that point, radiation and surgery may be best treatment options. Active surveillance is best if you have a small, slow-growing, low-risk cancer. It's good for men who do not want to have symptoms. If you want to avoid sexual, urinary, or bowel side effects for as long as possible, this may be the treatment for you. Active surveillance allows men to maintain their quality of life longer without risking the success of treatment. Action is taken only if the disease changes or grows. For many men, they never need more aggressive treatments. Active surveillance is mainly used to delay or avoid aggressive therapy. On the other hand, this method may require you to have several biopsies over time to track cancer growth. Watchful waiting is a less involved system of monitoring the cancer without treating it. It does not involve regular biopsies or other active surveillance tools. It is best for men with prostate cancer who do not want or cannot have therapy. It is also good for men who have other medical conditions that would interfere with more aggressive forms of treatment. The main benefit of watchful waiting is that there are no treatment-related risks, complications, or side effects, and it is low cost. The risk of watchful waiting is that the cancer could grow and spread between follow-up visits. This makes it harder to treat over time. Now, what about radical prostatectomy or surgery for prostate cancer? There are 3 types of radical prostatectomy surgeries, but the robotically assisted laparoscopic radical prostatectomy with the Da Vinci surgical robot is the most common type of prostate cancer surgery done today. The surgeon is assisted with a robotic system that holds and guides the laparoscopic surgical tools and camera. It also allows the prostate to be removed through tiny ports placed in your belly. In experienced hands, the robotic prostatectomy have great outcomes. There is also less blood loss with robotic surgery than with other methods. The success of this surgery depends on how experienced your urologist is. The more surgeries he or she has done, the likely better she is at this surgery. After the prostate has been removed, the urinary tract and the bladder are reconstructed. A catheter is passed through the urethra into the bladder to drain the urine while the new connections heal. 1 or 2 suction drains may be left in the pelvic cavity after surgery. They are brought through the lower belly to drain fluid from the wound. They help lower the risk of infection. The drains are usually removed before you are discharged from the hospital. After surgery, your surgeon will review the final pathology report. Together, you will make plans for the next steps. The main benefit of a radical prostatectomy is the prostate cancer removal. This is true as long as the cancer hasn't spread outside the prostate. Surgery also helps the healthcare provider know if you need more treatment. The goal of surgery is to get a PSA value of less than 0.01 for 10 years. Surgery is often a good choice if the prostate cancer has not spread beyond the prostate. But surgery always comes with risks. Some complications from surgery can happen earlier and some later. Bleeding or infection can happen with any major operation, so you will be monitored to prevent or manage these problems. Not everyone has the same side effects for the same amount of time. With surgery and radiation therapy, there are 2 main side effects to consider: erectile dysfunction and urinary incontinence. For some men, Surgery can relieve pre-existing urinary obstruction. Most men with these side effects find ways to manage them over time. All men have some form of erectile dysfunction after prostate surgery. Erectile dysfunction is the inability of a man to have an erection long enough for satisfying sexual activity. Nerves involved in the erection process surround the prostate gland, and they can be affected by radiation treatment. The nerve bundles help control blood flow to the penis. The length of time erectile dysfunction lasts after treatment depends on many things, including how firm your erections are before treatment. Sometimes it may take 1 year or longer to recover erectile function. In the meantime, your doctor may have erectile dysfunction treatment options for you. If it's possible, nerve-sparing surgery may help prevent long-term damage. Older men have a higher chance of permanent erectile dysfunction after this surgery. Now, it may surprise you to know that men are still able to have an orgasm or climax, even after a radical prostatectomy. An erection is not needed to climax. There will be very little, if any, fluid with an orgasm. In addition, you can no longer cause a pregnancy after surgery. This is because the prostate, seminal vesicles, and connections to the testicles were removed, and the vas deferens was divided during surgery. Planning for fertility preservation in advance of surgery is an option for men who want to have children. It is important to know that sexual desire is not lost with this surgery or radiation treatment. The exception to this is if hormones are also given as part of treatment, usually given temporarily with radiation therapy. What is radiation therapy? Radiation therapy uses high-energy rays to kill or slow the growth of cancer cells. Radiation can be used as the primary treatment for prostate cancer instead of surgery. It can also be used after surgery if the cancer is not fully removed or if it returns. Radiation therapy mostly involves photon beams or proton beams. Photon beams make up traditional X-rays. They carry a very low radiation charge and mass and can scatter to nearby healthy tissue. On the other hand, proton beams have more charge and a heavier mass and can target deep tissue. A physician can direct proton radiation treatment to the specific site of cancer, minimizing damage to nearby healthy tissue. Before you begin, it helps to ask your doctor why they recommend one type of radiation over another. There are two primary kinds of radiation therapy used for prostate cancer: external beam radiation therapy and brachytherapy, which is internal radiation. Traditionally, external beam radiation therapy has been using the photon or X-ray. Photon-based external beam X-rays may damage nearby healthy tissue. That damage can cause side effects. Your healthcare provider may be able to offer three-dimensional conformal radiotherapy or intensity modulated radiotherapy instead. Some newer machines have image scanners built into them. 3D conformal radiation therapy creates 3D digital maps to map the shape, size, and location of tumors. It allows higher doses of radiation to be delivered to cancer cells while protecting surrounding healthy tissue. Proton beam therapy is another type of external beam radiation therapy, but it uses the proton. It uses a machine called a synchrotron or cyclotron to speed up and control the protons. High energy protons can travel deeper into body tissue than low energy photons. With photon therapy, radiation does not go beyond the tumor, so nearby tissues are not affected. There are fewer side effects. Intensity modulated proton beam therapy is a new way to deliver targeted proton beam therapy, but these machines are expensive and not offered everywhere. Stereotactic body radiation therapy delivers large doses of radiation to exact areas, such as the prostate, with advanced imaging. The entire course of treatment is given over a shorter period for just a few days. This type of radiation therapy is known by the names of the machines that deliver the radiation, such as the Gamma Knife, X Knife, Cyber Knife, and Clinac. With any radiation treatment, you should discuss the side effects before you begin. Prostate brachytherapy, or internal radiation therapy. With brachytherapy, radioactive material is placed directly into the prostate using a hollow needle. There are two types of brachytherapy, low dose rate and high dose rate. Low dose rate brachytherapy is when your doctor uses a thin needle to insert radioactive seeds, the size of a grain of rice, into the prostate. These seeds send out radiation, killing the prostate cancer cells nearby. In low dose radiation therapy, the seeds are left in the prostate even after the treatment is finished. High-dose radiation brachytherapy is when your doctor puts radiation into your prostate using a slightly larger hollow needle to insert a thin catheter. This catheter stays in your body until treatment is done. The radiation source stays in your prostate for a short period of time. Once your treatment is done, all radioactive material is removed. Anesthesia is needed to insert the needles for both low-dose and high-dose brachytherapy. You may need to stay in the hospital overnight. Sometimes radiation therapy is combined with hormone therapy to shrink the prostate before starting. Or, hormone therapy may be combined with external beam therapy to treat high-risk cancers. The benefit of radiation therapy is that it is less invasive than surgery. Whether the radiation is given externally or internally, this treatment is effective for early-stage prostate cancer. Some need both types of radiation combined to treat their cancer. The main side effects of radiotherapy are incontinence and bowel problems. Urinary problems usually improve over time, but in some men they will never go away. Erectile dysfunction, including impotence, is also possible. Many men feel tired for a few months or weeks after treatment. If hormonal therapy is used with radiation, sexual side effects are common. These can include loss of sex drive, hot flashes, weight gain, fatigue, decreased bone density, and depression. Fortunately, these side effects can be managed and usually go away when hormone therapy is stopped. It helps to work with your radiologist before you begin treatment to prepare for any known side effects in advance. Follow-up visits with your healthcare team will help you address any new problems. What is cryotherapy? Cryotherapy for prostate cancer is the controlled freezing of the prostate gland. The freezing destroys cancer cells. Cryotherapy is done under anesthesia. This treatment is for men who are not good candidates for surgery or radiotherapy because of other health issues. For this procedure, the prostate is imaged and measured. Special needles called cryoprobes are placed in the prostate under the skin. The needles are guided by ultrasound to direct the freezing process. A catheter will be used in the hospital until you can urinate on your own. After cryotherapy, a patient is monitored with regular PSA tests and in some cases a biopsy. Cryotherapy has been found to have some side effects. You may experience incontinence and other urinary or bowel problems at first, and erectile dysfunction is highly likely. Worth noting is the risk of a fistula. A fistula is a channel that forms after surgery between the urethra and the rectum. This may be causing diarrhea or bladder infections and is a devastating and difficult complication to fix. Another treatment option is Haifu, or high-intensity focused ultrasound. Haifu uses the energy of sound waves to target and superheat the tumor to kill cells with the help of MRI scans. It can be used for the whole gland or focal cryoablation, which uses a needle-thin probe to circle the tumor with a special solution that kills the tumor by freezing it. There's also irreversible electrocorporation, which uses a nanoknife to pass an electrical current through the tumor. The electricity creates very tiny openings called pores in the tumor cells, leading to cell death. For men with small localized prostate tumors, focal therapy may be an option. Focal therapy is a general term for a few methods. They kill small tumors inside the prostate without destroying the whole gland or healthy tissues nearby. There are a few types of focal trials in clinical trials. Focal therapy would potentially lead to fewer side effects, including changes in urinary function. The long-term benefits of focal therapy are not yet known. Research is being done to study this further. Right now, the FDA has approved this method to destroy prostate tissue, but not clearly to treat prostate cancer. Because so many of these treatments are so new, insurance coverage sometimes is spotty. This is Dr. Judson Brandeis, urologist and Hive 80 member. Thank you for your attention. Tune back in to Hive 80 for continual medical and wellness information. Wishing you the best of health.